The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 in Focus.
Hello, I'm Susan Shapiro. The fall resurgence of coronavirus is here. Pennsylvania has had more than 5,000 new cases in a couple of days. How is the state dealing with these new cases and with hospitalizations? And what about preparation for the vaccine? Tonight, we pose questions to the Secretary of Health, Dr. Rachel Levine, and the Commissioner of the Food and Drug Administration, Dr. Stephen Hahn, as we continue to bring corona.
The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 in Focus.
Hello, I'm Susan Shapiro. The fall resurgence of coronavirus is here. Pennsylvania has had more than 5,000 new cases in a couple of days. How is the state dealing with these new cases and with hospitalizations? And what about preparation for the vaccine? Tonight, we pose questions to the Secretary of Health, Dr. Rachel Levine, and the Commissioner of the Food and Drug Administration, Dr. Stephen Hahn, as we continue to bring coronavirus in focus. I'm joined now by Stephen Hahn, who's the Commissioner of the Food and Drug Administration. Thanks so much for joining us.
Well, thank you, Susan, very much. It's really great to be here and with the people of Harrisburg and the people of Pennsylvania, and hope everyone's staying safe.
Since you have a lot of connection to the Pennsylvania state and to the area.
For sure, was born and raised here and was at Penn for 18 years.
Let me ask you first off, in a Biden administration, what do you expect your role to be with the FDA? Do you expect to continue?
So I'm a presidential appointee, Senate confirmed, and in those situations, my understanding is that if there's a transition, that there'll be a resignation process for all those political appointees, and then it'll really be up to the Biden team to make those decisions.
Dr. Hahn, we are seeing a surge in coronavirus cases in Pennsylvania and throughout the nation. What's your concern about that?
So we are seeing a surge in cases, and this is a serious problem. As the weather gets cold, as people move indoors, as we approach the holidays, there are a lot of opportunities, fortunately, for close contact among families. And what we're seeing is that interior close contact is precipitating some community spread around the country. And it's a really serious problem. This virus is still with us. So we really have to be careful about large gatherings, about indoor gatherings, practice social distancing, physical distancing, wear a mask. Wash your hands frequently and protect the vulnerable. This is so important for our folks who are vulnerable, particularly the elderly and long-term care facilities. We must absolutely practice these measures. And it's hard during the holiday season, but it is critical to put this pandemic behind us.
It doesn't seem as if we've heard a lot from the coronavirus task force of late. Is that concerning to you, or is there work obviously still going on?
Yeah, there's definitely work going on. We have been messaging regularly with the states and the governors and health officials. Dr. Birx and Dr. Redfield have been making a lot of trips outside of Washington to localities to spread this message about what needs to be done for mitigation. We're also obviously focused on the development of therapeutics and vaccines, and continue to try to support that effort through the Department of Health and Human Services as well as the White House.
You said wear a mask. There's obviously been a lot of politicization of mask wearing and some conflicting information, but you're convinced that that does help to contain this virus?
I think if we look at the scientific data, but also what has happened across some of the states, you may remember that we had an outbreak across the Sun Belt earlier in the year, in the summer. And when that occurred, we saw that these measures, very simple common sense measures of physical distancing, hand washing, mask wearing, avoiding large crowds, that really did lead to a diminution or a decrease in the outbreak and helped to flatten that curve and bring the cases down. We know that works. We've seen that work in other countries around the world. So the empirical evidence is behind all of these factors put together, helping us contain the pandemic.
And a lot, obviously, along with the social distancing.
Yes, social distancing, hand washing, protecting the elderly, and mask wearing. I think it has to be put together as a package. They're common sense measures. We need to get through this winter. This is a time when respiratory illnesses seem to spread pretty quickly, and we need to make sure that we're practicing these efforts.
Is this worse than you thought it would be?
Well, we always knew that the winter time could very well, fall and winter could very well be a serious time. Obviously, we had hoped for a different outcome than we're seeing right now, but we are seeing what we're seeing, and we just have to stay focused on these common sense mitigation efforts. So we all want to see this go away. We all want to put this behind us. This has been a long time in our country, around the world, and we just have to focus on these measures as we wait for vaccines and therapeutics.
And we'll talk more about the vaccines, but in terms of treatment, we certainly do have better treatment than we had at the onset of the pandemic, and we know a lot more about it, don't we?
Yes, I think that's the positive story out of this. Since February, March, and April, we've learned a lot about the disease. There's a lot of information from medical care providers about how to take care of patients who are sick with COVID-19. There are also new therapeutics. There's remdesivir, there's steroids, there's convalescent plasma, and recently we authorized the use of a monoclonal antibody for early phases of the disease. So we've seen a lot of therapeutics come through the clinical trials process. We've looked at the data at FDA, and they're now for providers available to provide to patients. So we're in a fundamentally different place compared to March and April. However, one of the best ways we can fight this is prevention of the disease and mitigation of the spread. And again, despite all that good news about therapeutics, and that is really good news, we have to focus on the mitigation.
All right. Well, we also have to focus on that vaccine since it has been some exciting news this week. We'll talk more about that when we continue our conversation.
This is WGAL 8 in Focus, coverage you can count on.
We continue our conversation with Dr. Stephen Hahn, the Commissioner of the Food and Drug Administration. Again, thanks for being here. We heard this exciting news that Pfizer has a vaccine that appears to be very good, 90% effective. What's your reaction to that?
So we have seen the press release, and we're working with many different manufacturers and sponsors of our vaccine. So I agree. I'm very optimistic about the information. One of the things that FDA does is that we look at the data associated with the clinical trial. So the way this works is that when a sponsor manufacturer like Pfizer or others feel that the data are ready to submit to us for an application, they will do so. And then we'll look at the data. And what Americans should know is that FDA is one of the few, if not the only, regulatory agency in the world that looks at the primary data from a clinical trial. We look at the raw data and we analyze it and come to our own conclusions, because our job is to call the balls and strikes around safety and effectiveness of a vaccine. And while we review this data expeditiously, as quickly as possible, we're not going to cut any corners. And our promise to the American people is when we review it and make a decision, we will do it with the data about the safety and the effectiveness.
So you don't think you've received any pressure from the administration to fast track this vaccine in any way?
Well, obviously with the state of the pandemic, Susan, as we talked about, there's pressure to get a vaccine out there as quickly as possible. And we recognize that at the agency. But one thing that's our solemn promise, and is something that we have done throughout our history at Food and Drug Administration, is to actually look at data and make decisions based upon those data. We have made a promise to the American people that we would not approve a vaccine unless we were sure that the data supported safety and effectiveness. We also won't approve a vaccine that we wouldn't want our own families to receive.
This study involved some 40,000 people. Is that enough to give you a sense that this is effective and safe?
The short answer is yes, it should. But again, it's all dependent upon the data that we see, Susan. So these trials are designed, and the number of individuals in the trials are designed based upon a certain floor of effectiveness. And when we put our guidance out at FDA, we said, we want you to be able to design a trial to detect a floor, so a minimum effectiveness of 50%. So that's where the number of 30,000, this one was expanded to above 40,000, came from. And so from a sort of methods point of view for clinical trials, that is a sufficient trial size to help us detect effectiveness. Now, just to put it in perspective, if you look over the last several years at trials of vaccines that have come to the agency, the number of participants in those trials has been anywhere from about 5,000 up to about 60,000, with an average around 21 to 22,000. So you can see this 40,000 plus study is well within the range of what we normally see, and in fact exceeds that.
This vaccine is going to require 2 doses, and also there are obviously some challenges with it, that it has to be kept at super low temperatures for long storage. What do you think that means in terms of distribution?
So distribution will be an effort by the company, whichever company receives authorization or approval for a vaccine, and the CDC, Centers for Disease Control. Our job at FDA is to ensure that there's quality manufacturing and that each lot of drug or vaccine that's made is of that same high quality. We obviously, when we or if we issue an authorization around a product, we're going to be very specific about what needs to be done to handle that product to make sure that it stays high quality before it's administered to someone. So we'll work very closely with the manufacturers and with the CDC to ensure that happens. That's part of what we need to do in U.S. government in partnership with a company such as Pfizer.
But does that concern you at all, that the fact that it needs 2 doses and has to be kept at these low temperatures? That could be a problem worldwide, I would think.
So it could be. I think that's what we all have to figure out as we move forward. If the data support an authorization or an approval of a vaccine, we have to accept what the product is. We have to figure out the best way, in conjunction with the sponsor, the manufacturer, but also the CDC, of delivering that. So these challenges can be overcome. I'm confident that they can be overcome. It all depends on the data. And if the data continue to support a highly effective vaccine, our job as a government, but also as the sponsor, the manufacturer, is to find a way to make sure that that can be delivered safely.
Well, let's hope so. We thank you very much for joining us and wish you the best. Thank you.
Thank you, Susan. Take care. My best to the people of Harrisburg.
All right. Thank you. And we'll
care.
speak now with the Secretary of Health, Dr. Rachel Levine, about this surge in Pennsylvania of coronavirus.
This is WGAL 8 in Focus, coverage you can count on.
Joining us now is Dr. Rachel Levine, the Secretary of Health in Pennsylvania. Thanks for being here.
My pleasure.
Dr. Levine, we have now seen cases for the first time since many months rise above 5,000 a day. What is causing this surge?
Sure. So we are in the middle of the fall resurgence that we have been talking about for months and months and planning for. And this is happening throughout the country. The Midwest and the Mountain West are particularly impacted, but actually every state in the country is seeing significant increases in the number of new cases.
What do you think is causing it?
Well, because we're in the fall and the weather is changing. Respiratory viruses frequently go up in the fall and winter. What we're used to seeing is influenza, the flu, but it's the same in terms of COVID-19. When people head indoors, it leads to more spread of these type of respiratory viruses. And we're seeing significant community spread in really almost every county in Pennsylvania.
It is kind of scary, don't you think?
It is very concerning about the number of new cases. As you said, we're seeing over 5,000 new cases a day. That's actually much higher than the case rates we saw in the spring. And so it highlights how much we all need to work together. We like to say, answer the call and stand united in Pennsylvania against COVID-19.
We have also seen an increase in the positivity rate, the percentage of cases that are positive among those tested, correct?
That is correct. In Pennsylvania now, our percent positivity is approximately 7%. A week ago, it was 6%. A week before that, it was 5%. And that is consistent with the increase in new cases. It particularly tells us that the increase in new cases is not simply due to more testing, it's due to more COVID.
I was going to say, a lot of people would argue, well, we're testing more. That's why we're seeing more cases.
No, but that's not the reason. We're seeing, because throughout the country, significant increases in percent positivity as well. We're also seeing significant increases in the number of patients that are requiring hospitalization because they're sick with COVID-19.
Is there a particular population this is affecting now, or is this more widespread than that?
This is widespread. So unlike the increase we saw in, say, September, where it was particularly among 18 to 24-year-olds and college students. This increase is in all age groups, children, as well as seniors and everyone in between. And we actually today had 61 out of 67 counties that saw a significant rise over the last week. So it is in rural Pennsylvania, suburban Pennsylvania, urban Pennsylvania, north, south, east, and west, all age groups.
And I know we keep hearing the virus is less virulent than it has been in the past. Is that true?
That is not correct at all. There is absolutely no evidence that the virus is less severe or less virulent than it was. What is different is that our medical care is better. I mean, as we've said all along, this is a novel or a new coronavirus. And so in the spring, doctors and health systems had only really seen the virus for a couple of months. We have a lot of experience, unfortunately, with the virus now, and our medical care in hospitals and intensive care units is much better. We also have therapeutics. We have remdesivir. We have a medicine called dexamethasone, not a new medicine, but a medicine that can be very helpful in terms of decreasing the inflammation. We are now going to be seeing the distribution of monoclonal antibodies produced by Lilly, and we're working on that distribution now. And we have the possibility of convalescent plasma as a therapeutic. So all of our treatment is better. And so, you know, the death rate in the hospitals is not what it was before. But we are starting to see in Pennsylvania, and other states have certainly seen an increase in deaths as well. There's a lag time.
I see. What do we know, just quickly, about this virus that we didn't know early on, do you think?
Well, we know, for example, that asymptomatic people can certainly lead to spread of the virus. That was somewhat, that was an unknown at the beginning in last winter. And even in the spring, that was somewhat debated. But we know that people can have COVID-19. They can be completely asymptomatic, yet they are contagious and can spread the virus. So that would be one thing that we know very well now, which does inform our public health response.
All right, well, we'll talk more about that public health response and whether additional mitigation measures are needed. Stay with us.
This is WGAL 8 in Focus, coverage you can count on.
Dr. Rachel Levine, the Pennsylvania Secretary of Health, is our guest, and we're talking obviously about coronavirus and whether more mitigation measures are needed. Dr. Levine, we're seeing high positivity rates, a surge in cases. Is this a time to go back to those phases we had at the beginning of the pandemic?
Well, as I've been saying, there are three ways to deal with the pandemic. We work on containment. That includes testing, contact tracing, isolation, and quarantine. The other tool in the toolbox is mitigation, and the third tool is the distribution and administration of a vaccine. So we need all the tools in the toolbox. So we do have current mitigation orders in place. There is a universal mask order in Pennsylvania. We want to emphasize that. There are limitations on indoor dining at restaurants, and there are still large gathering limitations indoors and outdoors. So we want to highlight those and make sure that we double down on those and are enforcing those. Will more mitigation measures be necessary in the future? It's hard for me to predict. We'll see what the case counts show. We're not taking anything off the table, but nothing at this point.
You know, surrounding states, New Jersey, New York, are going to further restrictions. Do you think we have enough or have as much as they do?
Well, some of the restrictions they're going to, we already have in place. I mean, we already stopped serving alcohol late at night. They're talking about doing that. So some of those we all have in place. We do speak with other states on a frequent basis on numerous phone calls and coordinate as much as possible. We might not be doing exactly what they're doing, but we're having discussions now. We're going to see where our case counts lead.
Dr. Levine, we heard some promising news from Pfizer, which says it has a vaccine that proved to be 90% effective in its trials. What is Pennsylvania doing to prepare to distribute that vaccine?
Yes, very good news this week. We have had a vaccine task force now for months and months. We have been working very, very hard in collaboration with the CDC federally, with other states, and then also with our county municipal health departments in terms of the distribution and then administration of a vaccine. And there might be a number of vaccines that are being looked at under Operation Warp Speed federally. So the Pfizer vaccine looks like it'll be first out. We don't know exactly when that'll occur. We're very pleased that science is driving this process and not political considerations. When Pfizer announces that they have completed their effectiveness and safety trials, then it'll go to the FDA for a consideration of an emergency use authorization. Then it goes to the CDC for recommendations, and then we will stand ready to distribute and administer that vaccine and other vaccines that might be in the pipeline.
And how do you convince people that they should get the vaccine?
Well, we're going to have a robust communication effort to talk about the safety and effectiveness of this vaccine. There has been vaccine hesitancy, as you alluded to, and so we need to work past that. We need to reassure people that this will be a vaccine that is really important, and again, it'll be one of the critical tools in our toolbox in public health to address the virus.
But I guess a vaccine is certainly not a panacea for a pandemic, is it?
It's not a panacea. Again, it's one more tool in the toolbox that we're going to have to make sure that people understand this is not going to come out all at once. We don't know exactly when it'll come out or how many doses that we will get, but what the CDC has been talking about is 3 phases of vaccine distribution. Again, different vaccines. This Pfizer vaccine has to be kept at minus 80 degrees centigrade, so it has distribution challenges in terms of storing it. In addition, this vaccine requires 2 doses. A number of the other vaccines require 2 doses, so we have to plan for that. So this whole process of vaccine distribution and administration, it will take months and months in 2021. So it isn't no quick fix, but it's going to be a very important development when it comes out.
Just quickly, is this pandemic something we're going to be living with for a while, do you think?
It depends what you mean for a while. I'm a very positive and optimistic person, and working together, standing united, we can overcome this. We can work to control and overcome COVID-19. But this fall and winter is going to be very challenging. We'll, I think, have more tools in the toolbox as we get into 2021. And I am very confident that things in a year will be much better than they are now.
All right. Well, thank you so much, Dr. Levine. We appreciate you joining us.
Thank you.
Thank you for joining us for WGAL 8 in Focus. For all of us here at WGAL, I'm Susan Shapiro. And be sure to join us next week for WGAL 8 in Focus at 7 o'clock after NBC Nightly News.